spirit and give the greatest gift of all this year. Give life. Your blood donation could help save as many as 3 patients at your local hospitals. Visit lifesouth.org for more information and locations. Share the love. Share life. Give blood.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
All right, 3 minutes after 11 o'clock. Thank you for tuning in this morning. When Michael J. Fox was diagnosed with Parkinson's, I don't know how many of you knew somebody with Parkinson's, but suddenly we knew what it looked like, didn't we?
Yes.
And so sometimes, as sad as it is for anybody to get any disease, when somebody who is a celebrity has something happen to them, we all become mini experts on that thing, even though we're not experts at all. So let's talk about Parkinson's disease a little bit. The new initiative is called Live Well, Do Tell. I have on the podcast I guess that's the logo from the Accorda.com website. Dr. Matthew B. Stern and Steve DeWitte are on the phone. Dr. Stern is a neurologist. He's the professor emeritus of neurology at the Perelman School of Medicine at the University of Pennsylvania. He's the former director of the Penn Parkinson's Disease and Movement Disorders Center and the past president of the International Parkinson and Movement Disorder Society. And Steve DeWitte is on the phone, diagnosed with Parkinson's disease March of 2005. He was only 48 at that time. He's been recognized as a champion of change at the White House. He's the recipient of the 2017 Alan Bonander Humanitarian Award presented by the Parkinson's Alliance. And both gentlemen are on the phone to talk to us a little bit about what Steve is going through, so that if you know somebody who's also going through that, maybe you'll have a little ammunition, I guess. That's a crazy word to use, isn't it? Dr. Matthew Stern and Steve DeWitte, good morning, sirs.
Good morning. How are you?
Larry. Thank you.
Where are you guys?
We're in New York.
Steve, when you were first diagnosed, did you even know what it was?
You know, I didn't, Larry, and it was quite a shock. But because I didn't know what it was, it led me to maybe not react so emotionally about it and just focus on the education of what I need to do beyond that.
Did your attitude help you? Let's see. Not deny what I'm trying to say. Like with the diagnosis, whatever the doctors told you to expect, did you fight against that? And have you been able to live differently than they told you what to expect? I'm stumbling through that, but I hope you understand what I mean.
I do. And you know what's interesting about that? Very good question. You know, when you're first diagnosed, you don't know how to react. And so doctors didn't really explain to you what was ahead, because the disease is different for everybody. And we were learning more about the disease and some of the symptoms that are not even that visual. And I know Dr. Stern will speak a little bit about what the disease is, but as you get to understand it yourself more, you find that there's a lot of things that you could take upon yourself to fight the disease. And you learn that in talking to others and your clinician and a number of stakeholders, and that gives you the strength to go on.
Actually, Larry, in asking that question, you really bring up an important area. You said what to expect. Mm-hmm. Well, that's really important because patients tend to expect a lot worse than the nature of this disorder. And in fact, much of what we have to do is really unburden patients from what these expectations are, because this condition is so heterogeneous. It affects different people in different ways. And the bottom line is when we make that diagnosis, we really try to be optimistic and encourage patients that through current treatments and initiatives like this, they should be able to live rich and full lives for a long, long time, if not forever.
And when you say rich and full lives, that also means that Parkinson's patients can hold down a job.
Absolutely. And one of the unusual things about Parkinson's is that it tends to affect people in the prime of their life. Like Steve was 48. The average age of onset is really 55 or 60 when many individuals are working.
And so is part of the message today in 2018 for the Parkinson's patient and the other for the people who love that person? Is there something we need to understand about Steve and about Michael J. Fox and other people who have Parkinson's?
Well, I think the important thing is, and what this initiative is all about, is really patient awareness of the heterogeneity of symptoms. For example, a patient comes in to see me, I can see their tremor, but that may not be what the most important issue for that given patient is. It may be that their golf game is deteriorating. It may be that they have fatigue. It may be that they have depression. And those are the things that really are affecting that patient's quality of life. So while I tend to focus on, I generically may tend to focus on that tremor, what I really need to focus on are these other symptoms. And the only way we're going to know about those is if patients are empowered to share those with their clinicians. And that's what the initiative is really all about.
Is Parkinson's hereditary?
There are genetic forms of Parkinson's. The majority of cases are what we call sporadic Parkinson's disease, in which there's no clear family history. But there are some genes that do cause Parkinson's. That's the minority.
So when a patient comes to you and says, here's a symptom that is not visible, is it always a challenge for you to come up with a strategy on how to deal with that symptom?
Well, it can be, but it also cannot be. I mean, if a patient admits to me that they're having problems with depression, we can treat that. But the issue is, and there are many examples, but I think of one patient, for example, that came in and had this tremor. I said, if I treat that tremor, are you going to be happy? The patient said yes. And I said, do you mind if I ask you a few more questions? And I asked him about his mood. Oh, I feel terrible. I'm depressed. How are you sleeping? I sleep terribly. And it's, why didn't you tell me that? And that's really the point of this initiative. Most individuals with a chronic illness don't want to go into their doctor and be told they're getting worse. They want to be told they're doing fine or getting better. And so there's a real obstacle to communicating effectively. And a lot of these conditions and symptoms are really unmet.
Do we know from people, and Steve, you are one of them, do we know from Steve and other people who've had it for a long time what to do? Like somebody who's newly diagnosed, is there some help? Like somebody, like you're a veteran of this disease, can you help the newbie, somebody who's new?
We do set up support programs and differentiate them on what I'll call young onset, those that are fairly newly diagnosed, and then a more traditional diagnosed patient, which may be more senior. And the meetings are different, and you encourage them to address their matters of concern, certainly where they're at. And so whereas a young onset may be worried about their job, may be worried about their tennis game coming back, and some of the matters that we considered important to us at a younger age, as they get older, there's different concerns. And so Live Well, Do Tell tries to meet everybody at where they're at. And the bottom line is for the communication to be not restrained, but very open with your physician.
And you have recognized that it takes more than one person to bring awareness of this, and you formed the Make a Difference Parkinson Alliance, and then you had to recruit people to be mentors to others that have Parkinson's.
That's correct, and that's a tremendous support to the individuals, because when you can talk to someone else that has the same challenges that you do, it puts you at ease that you're not alone, and they may have some suggestions on how to treat it. And livewelldotell.org, that program that's there, also emphasizes helpful hints on being able to come forward and speak about these matters.
Doctor, is there anything new in medicine itself that helps out somebody with Parkinson's?
Well, first of all, I just want to emphasize that many of the symptoms of Parkinson's are treatable. We have a whole variety of medications and surgical approaches that have been very effective and have really changed the natural history of Parkinson's disease in recent years, and there's a lot in development. So when I see a patient who's newly diagnosed, I generally paint a very optimistic picture because there's so much we can do in helping to reduce the disability that can be associated with Parkinson's disease and help individuals with Parkinson's live a rich and full life.
And do people with Parkinson's, do they have good moments and not so good moments?
Yeah, so these are so-called off periods, and which is another initiative from Live Well, Do Tell. So patients who are on treatment usually have a good response for periods of time, and then they'll have a reemergence of symptoms, and those are called off periods. And during these off periods, they can have the common symptoms like tremor, but they can also have uncommon symptoms like fatigue and pain and anxiety. And that can occur at several points throughout the day. So communicating that is very important because, again, those are potentially treatable symptoms.
Gentlemen, thank you for both being on the show with us today. Before we say goodbye, can you recommend a website or a way for people to get more information?
LiveWellDoTell.org. That's the website that's launched today, and there's some great information on it. Thanks for asking and having us on the program. LiveWellDoTell.org.
LiveWellDoTell.org. Dr. Matthew Stern, Steve DeWitte, take care of yourselves, guys. Thank you for being on the show with us today.
Thanks for having us.
You're welcome. We'll be right back.
In this moment, who has your back? Do you know the name of your insurance agent?